Thank you for joining us here at the webinar about leveraging community conditions for future funding proposals related to the Health Foundation of Greater Massillon. We are going to give it another minute as we still have some more people joining, and then we'll get started. All right. Well, welcome. Welcome to the webinar this morning. We're so pleased that you have joined us. I'm Emily Campbell. I'm the Chief Operating Officer at the Center for Community Solutions. And as you'll hear in a moment, we've had the opportunity to collaborate with Start Community Foundation and Health Foundation of Greater Massillon to pull together some data and information. I want to turn it over now to Amy Krebs with Start Community Foundation to provide some context and welcome us all this morning.
Thank you, Emily, and good morning, everyone. Before I give it right back to Emily, I thought it would be helpful for those of you who aren't familiar with the Health Foundation of Greater Massillon to just give you a brief snapshot on who they are and their contributions in the community. So in Massillon Community Hospital, and Akron General Medical Center entered into a joint venture in 1999. The Health Foundation of Greater Massillon was created to ensure resources would always be available to support health and wellness programs and initiatives in Western Stark, Northern Tuscarawas, and Eastern Wayne counties. So since then, more than $3 million has been awarded to local organizations to improve the health and wellness of individuals and families in the community. And their connection, the Health Foundation's connection to Start Community Foundation, has been since 2016, when the private foundation transitioned to a supporting foundation and joined our family of donors. And I also wanted to mention briefly the Health Foundation's mission. And that's to enable health status improvement, wellness activities, and community well-being by investing in organizations that provide services in our communities. And we'll put a link in the chat so you can get right to the landing page with the Health Foundation of Greater Massillon. I want to point out that the community fact sheets that Emily will be reviewing with you this morning are all located on the website. So when you have time to dig through them, they'll be there. You can access them at any time, as well as I'll turn your attention to important dates also listed on that website. And it includes the 2 meeting dates of the Health Foundation of Greater Massillon, including their upcoming grant deadline of August 31st. And part of the reason that the Health Foundation of Greater Massillon is providing this webinar and partnering with the Center for Community Solutions is to be all the more thoughtful when they invest money in the community, to do so with data in mind. So while we want to approach it in that way, we thought, of course, it was very fair that we share that data that they have in mind with all of you and see how you can inform it. So with that, I'll turn it over to Emily so she can start sharing that data with all of us. Thank you.
Wonderful. Thank you, Amy. Yes, today what we're going to do is share some of the data and information, talk a little bit about how we pulled it together, a tiny bit about how you might want to use this, but leave lots of time if folks have questions or want to have a discussion in order to talk a little bit more about some of this information, recognizing that a lot of it may be new or some of it may be new. We'll find out. So first, a little bit about my organization, the Center for Community Solutions. And if I could just get a thumbs up that the slide advanced for all of you. Great. That's always, first hurdle crossed. So Community Solutions is a nonprofit, nonpartisan policy and research think tank. We've been around since 1913, so we're celebrating our 110th anniversary. of working to improve health, social, and economic conditions. And we do that through public policy and through applied research. We work with agencies and organizations and government across the state who are interested in issues often that relate to the health and human service safety net, to health, to poverty, to some of those issues that often impact low-income people. We also have an office in Columbus that is very busy this week, working diligently on the state budget. And, we partner with agencies and organizations like Start Community Foundation and the Health Foundation of Greater Massillon to provide what we like to think of as decision support. So information that people need to make decisions about how to target resources, about how to have greater impact, about what's happening in their communities that they might want to take a look at. And so that's part of why we're here today. We've had the opportunity to partner with the Start Community Foundation for several years and are pleased to be able to also work with the Health Foundation of Greater Massillon. So let's get right into it. You're here today, so there obviously is something that is of interest to you that you want to hear about, but we think it is very important that efforts in communities be data informed. So, we often have perceptions about what's happening in communities, where needs might be, where we can have the most impact. But relying on data about community conditions can really help us understand a little bit better what's happening, to confirm or deny what we're hearing from people, and to see where there might be opportunities for a little bit of leverage that can have a big impact, and really dig in sometimes to some of the reasons that we see persistent community problems like poverty and like other things. And there's really 3 reasons that we think you should care about this data, and I'm sure you have your own. The first I mentioned is to understand community conditions, to have a better sense of what's happening in the communities that you're seeking to serve. Also targeting resources, thinking about where are those leverage points, where is the greatest need, where might there be the most opportunity, what else is happening in people's lives that may be preventing progress from being made on certain things, and then making the case for support. So we do hope that you will find this information useful as you are seeking funding and grants and other support to make the case for why the services that you all provide are so important. And so I know that the Health Foundation and the Community Foundation would be pleased to see some of the statistics from these fact sheets show up in your cases for support and in your grant applications, both to them, and please feel welcome to use them for other reasons as well. We really want them to be a resource for you all as you go forward and do your work. So we just think data is very important, but it's got to be useful, and it needs to illuminate something about the community that can help you in your work. We try not to put out a bunch of statistics that just sit on shelves, so to speak. We want it to be used and discussed and generate conversations. So to that end, Community Solutions has compiled data to produce a 2-page fact sheet for each of the communities, or almost all of the communities. There were a few that were not available that are covered by the Health Foundation of Greater Massillon. And here you can see the fact sheet for Worcester. That is what they all look like. They all look very consistent. We compiled the same data for each community. Today, I'll talk a little bit about how we pulled them together and how to use them, but I'll spend most of my time walking through some individual data points and pointing out trends or areas of interest. So I'm not going to walk through the data for each and every community. That would be boring. You don't need me to read you those statistics. But as we looked at these fact sheets as a whole and thought about trends in the counties, in the state, what are some things that really stood out to us? So a couple of things about the particular data points that you will see on these fact sheets. And the first is that we were significantly limited by the data that's available. We always look at the most reliable, most timely, the latest released information that we can find. But the reality is that some of these communities are really small. Very small population, as I'll talk about a little bit more. And so there's limited information that is available at that granular geographic level. Lots of stuff at the county level, tons of stuff at the state, much less when we get down to individual municipalities. And as you all know, in counties like Wayne, Tuscarawas, Stark, there are big differences between different parts of the county. So the county level may not really reflect what is happening. Although this is for a health foundation, we only have a tiny bit of health data that is available at small geographies, in this case, zip code. You see those there sort of on the second page, some information. These fact sheets focus more on the social determinants of health, things like housing, like income, education, those things that influence people's health over the lifetime, because we know that only about 20% of a person's health is actually determined by the health care that they receive, or what happens within the hospital walls, as healthcare providers sometimes call it. And so those social determinants are so important when we're thinking about health and well-being in communities. Here is a map of the communities that are covered. As Amy mentioned, the Health Foundation is interested in supporting activities in Western Stark County, part of Wayne County, and part of Tuscarawas County. And so you can see those blue areas are the communities that we were able to produce fact sheets for. There's some that, we don't have information for every place, but you can get a sense of where we're talking about and what we're looking at. Let me fully admit that I don't know how to pronounce every place in these 3 counties, so please forgive me if I mangle particular place names, but I'm going to try and do my best. So this is the geography that we are looking at. In order to pull together the data, there's really 2 sources that we lean very heavily on. The first is the U.S. Census Bureau's American Community Survey. This is what we at Community Solutions consider to be the gold standard in data about communities. It comes out consistently every year so that you can start to get a sense of trends. It's available consistently for geographies across the country, including small geographies, so we can really compare apples to apples for different places. And it's out there and you can explore it. You see the website there, data.census.gov. I'll talk a little bit more at the end of some of the resource if you want to explore the community that you're serving a little bit more and the data about it. The second source is created by the Centers for Disease Control and Prevention, the CDC. It's called PLACES. That's an acronym, but I don't remember what it's for. But what the CDC has done is created small area estimates for every zip code in the country for a series of consistent health outcomes, health factors, things that we can be watching. It is the best and really the only source of local data on people's health. Before they released the CDC Places data a few years ago, we just didn't have anything. We had to rely on those county level estimates for a lot of this health data. And so we're really happy that now we at least have something we can look at, even if it is only at zip code instead of those municipalities. But like any data source, these both have limitations. The one that I want to mention right up front is that these are estimates. So if you went out and asked every person in any of these communities about some of these things, the number that you may come up with is a little bit different. But they are rigorous estimates that definitely represent the best that we have. And of course, we're limited in the kinds of information that are available, and we've done the best we can. And so as you look at some of these data points, if there's something that seems a little off, especially in communities that have a smaller population, that's where we get margins of error that are larger. And so, they may be a little off, but believe me, trust me, this is the best data that we have about things like housing, poverty, education, income, employment, and health. So, the size of the population is important when we're thinking about the American Community Survey data. And you can see on your screen this red note. It shows up on every one of the fact sheets. and that's data is for small geographies and carries margins of error, which can be substantial. Differences should be interpreted with caution. So the Census Bureau tells us that we really shouldn't compare which places are better or worse unless they're outside those margins of error, statistically significant differences. We often don't see those statistically significant differences. I still think it's useful to do some comparisons to get a sense of what might be happening and places that might be where people might be struggling more than others. So although that's the recommendation, and although we tell you right there that differences should be interpreted with caution, I'm going to throw caution to the wind to try and illuminate some things about communities. But I will say this, those municipalities that you see that have the number of the population like in the white in the bars, we have much more confidence that the data presented is accurate. It's more reliable. When you get into the smaller populations, especially North Lawrence, the margins of error are large. It's not that many people. And so we recognize that there can be big swings year to year. The other thing I'll say about the American Community Survey data before we really jump in is that we are relying on data that was collected through 2020 for much of this information. They are the 5-year American Community Survey estimates. They are the Census Bureau's best estimate for the year 2020 for these communities, but they look at 5 years of data to try and improve the reliability of those things. So we're starting to get some pandemic data in there, but not fully realized. These fact sheets were completed in the fall, and we shared them with the board of the Health Foundation of Greater Massillon, and that was the latest data that was available when we completed them. We have another year of data. Frankly, things don't change that much year over year, to be quite honest. And then we will get 2021 data, 2022 data in December. New data is released every December for some of these municipalities. So what's in them? We've included, like I mentioned, the things that we possibly could. We have data about demographics, including age and race and ethnicity, income, employment, and poverty, things like median income, labor force participation, poverty, public benefits incomes. Those of you familiar with the social determinants of health, this is all going to sound familiar. Data about education and housing, including educational attainment, unaffordable housing, old housing, and internet subscriptions. And then we get into the health data, health coverage and access, specifically the uninsured, people who are covered by Medicaid, and utilization of some preventive care by zip code. And then that CDC places data on health status and outcomes, including physical health risk factors and outcomes, and behavioral health risk factors and outcomes. So let me dive right into some of the data. I'm going to go through each of these areas and highlight a few things that we took away as we looked at the fact sheets as a whole, and that you may want to think about as you are using them in your own work. So the first has to do with racial and ethnic diversity. Communities are becoming more racially and ethnically diverse. Every new generation is more racially and ethnically diverse than the one before it. That's happening in Ohio. It's happening across the country. It's happening in communities within Ohio. And so here we have some data, which is not on the fact sheet, that sort of supplements to give you some context. And it's the share of the Stark County population who are Black or African American alone or in combination. So they may be, people who are both Black and white, who are mixed race, who are Hispanic and Black, whatever it may be, but Black alone or in combination. And you can immediately see that the pie on the left is bigger than the pie on the right. And so while 35% of Stark County's children are Black or African American alone or in combination, only 11% of older adults in Stark County over the age of 65 are Black or African American alone or in combination. Now, we also know that a lifetime of encountering systemic racism, we know that health outcomes are worse for people of color. We see a premature mortality. And so this does influence the diversity, frankly, of older adults as people die prematurely or as other groups live longer. But we're getting more diverse. and it's not going to turn around. Many of the communities that are covered in these fact sheets remain largely white. There's a couple of exceptions. North Lawrence, where we see a larger population who are Hispanic or Latinx. Orville, where we see a large percentage of the population who identify as other race or Black or African American. Massillon, of course, Black or other race. Wilmot, which we see both Black and Hispanic. And Worcester, which is more of a melting pot, probably associated in some ways with the college. But we see that Worcester has a larger percentage of people who are Black, who are other races, who are Asian, and who are Hispanic or Latinx. All the other communities are at least 90% non-Hispanic white alone. And so those are the communities that are more diverse. The other trend that we see relating to demographics has to do with age. Ohio is aging, Stark County is aging, these individual communities are aging. This is a chart that we produced for another project for Direction Home, Akron-Canton Area Agency on Aging. It's the area agency on aging that includes Stark County as well as Summit, I think Portage, maybe another one. But here you see the population projections for the number of people who will be over the age of 60 at different years. This is the age wave. This is the silver tsunami. It's here already. As you can see, a steep incline over the last 10 years, expected to continue until the age wave sort of crests in 2030, and then a slight reduction, but will still be well above where we were a decade or two ago, even after some of these demographic trends come through. The age wave is a result of the baby boomers being a large generation. The next largest after the baby boomers are millennials, so they're sort of coming up next. And also the result of people living longer in their communities. So two things that are kind of happening to really contribute to these demographic changes that we see. And this really matters in communities because we are already seeing that in a number of these communities, older adults outnumber children. This is a change. This is the first time in history where we are seeing so many communities where there are more people over the age of 60 or 65 than there are children under the age of 18. It's visible. We can see it as we're out and about in our communities. And it's, I hope, going to force communities, force government, force funders, force others to really think about where is the need in communities? Who do we need to target? Who's already here? And what can we do right now to help some of those things? So you see listed on the screen, those communities where older adults outnumber children. It's actually more than the places where children outnumber older adults. And again, this is based on the 2020 American Community Survey data. In Perry Township, it's tied. They're exactly the same. Well, you know, a couple people off, but tied in terms of percentage. Some of these communities may never flip, but we're seeing more and more every year as we look at this data. We're seeing more counties, we're seeing more communities where older adults outnumber young people. So something to keep in mind as you're planning your programming and thinking about targeting your own personal resources to have the greatest impact. Shifting in to think about income, employment, poverty, some of these economic issues that are parts of the social determinants of health. What we notice time and time again is that communities that are wealthier tend to have a lot of positive social determinants of health that go together. These health, social, and economic issues tend to cluster. And so one of the first things that we always look at when we're trying to understand a community is what is the median income? So the median income is the income where half of households earn more than that amount and half earn less. So for each of these bars that you see, half of households are earning more, half are earning even less. And we've included on here the Ohio numbers so that you can get a sense of the places where people may be doing better than the state average or where they may be doing worse than the state average. You'll notice on the fact sheets that wherever possible, we have included the Ohio averages so that you can kind of compare where communities stack up with their peers across the country. You know, these conditions all tend to go together. We see a wide spread in median household income in these communities, with Jackson Township, they're at the top, North Lawrence, they're at the bottom, and you can see where different places sort of fall out. One thing I'll note is that when we look across communities, the one right in the middle, the median of all of these communities is almost exactly at the median for the state, very close to the state average. But you all know these communities, and I'm sure you can immediately tell and immediately know some of the reasons and the conditions that are happening in some of these places. So I spent a lot of my time thinking about poverty, and we've included data on poverty in these fact sheets. Poverty is a cause or consequence of just about every other condition that we look at, and really is something that I believe is central to understanding communities. Here you can see the poverty thresholds for different size families for 2023. I share them here just as simple context. One thing that I want to note is that these are the same across the country. So the poverty threshold doesn't change based on cost of living. Someone living in New York City or San Francisco has the same poverty threshold as people here in Ohio. And the only thing that changes is the size of the family. It doesn't take into account how many people are children, how many people are older adults. So a family of 3 that is 2 adults and 1 child has the same poverty threshold as a family of 3 that is 1 adult and 2 children. And there's general recognition that this doesn't really reflect what people would actually need to get by with no outside assistance. So many public assistance programs are set at higher levels of poverty, which is where you hear 138% of the federal poverty level, 200%. Another thing to note is that Ohio is not a high wage state, despite the fact that our minimum wage is higher than the federal limit, and it increases every year based on inflation. Someone can work full-time, 40 hours a week, 52 weeks a year at Ohio's minimum wage and still earn less than that poverty threshold for a family of 3. Also want to note that Ohio median household income is actually below 200% of poverty for a family of 4. Again, that's the area where half people earn more, half of people earn less. I'm not suggesting that half of Ohioans are below 200% of poverty, but you just can get a sense of why so many people may be working and still struggling to get by or still living in poverty. So getting into some poverty trends, this is a trend that we see. Here's the data for Ohio, because I couldn't pick a community to share with you, but the trend is the same basically in each of these communities. The younger you are, the more likely you are to be living in poverty. There's a bunch of dynamics go along with that. We can talk more about that another time, or if you're interested in the Q&A in a little bit. In all of these communities that we looked at, there are nearly 18,000 people who were living in poverty. Over a quarter of them are children. So 1 out of every 4 people living in poverty in these communities is a child. This is a trend we see repeated in community after community. Of course, the solutions to poverty are different depending on age. For people who are in those working age groups, it's often about job training, about career advancement, about sustainable wages, about reducing barriers to employment, earning more. But we can't ask children to earn more. And poor children live in poor families. And so the quickest way to get children out of poverty is to help their parents earn more. When we get into older adults, we always see that older adult poverty is lower than other ages. There's a pretty simple reason for that, and it's because Social Security counts as income, where many of the programs that help families make ends meet, like supplemental nutrition assistance programs, SNAP or food stamps, like public housing or housing assistance, like Medicaid, like childcare, they don't count as income when they're calculating poverty. And so because we have Social Security, which is providing income to many, many older adults, that counts as income, their poverty rates are lower. It doesn't mean that people aren't struggling. We also provide data in the fact sheets for people that are in deep poverty, so 50% of those federal poverty thresholds, and people who are poor or near poor, up to 200% of those thresholds. You'll see that when we add up to 200%, we at least double the share of people in the community that are poor or near poor. 200% of the federal poverty level is the eligibility threshold for food assistance through food banks in Ohio, which is why we include it and why we think it's so important. There are a few places where poverty rate is higher than the state average. Those are Brewster, Massillon, Navarre, I don't know how to say that, and Beach City are the 4 places. Again, these trends are repeated community after community and provide important context for the services that you all are trying to provide and the change that you hope to see in communities. Something that certainly relates to poverty and to income and to employment is educational attainment. Also relates to health status as well. This chart shows the breadth of educational attainment in these communities. Jackson Township is at the top in terms of educational attainment. Wilmot is at the bottom. I want to encourage you to interpret some of these differences with caution, though. Again, we're talking about smaller geographies and small populations, and when we slice and dice it into different groups, the margins of error get bigger. So to read this chart, it's not in the fact sheet, but it's a way that we like to visualize it. We move up the scale in terms of educational attainment, and the numbers shown there are percent of the population over the age of 25 who have obtained that level of educational attainment. So the first one, the very light, are those who do not have a high school diploma or credential. Then we get to the little bit darker blue, a high school diploma or GED. Then some college or associate's degree. We have to group them together. The data just doesn't break it out. And then those that have a bachelor's degree or higher. So you can see that in Jackson Township, 43% of adults have a bachelor's degree or higher. It's actually the only one of these communities that we looked at for these fact sheets where that percentage is higher than the state average. And so Worcester, Canal Fulton, and Boulevard are very close to the state average, but they're not above it. So it gives you a sense of the conditions facing the people who you may be working with. Shifting gears away from income to think about housing. Housing is a very important social determinant of health, and we have some data related to housing that we've included in the fact sheet. Housing affordability is measured by the share of people who are paying at least 30% of their household income in their housing costs. For owners, housing costs include mortgage if they have one, property taxes, and utilities. For renters, it includes their rent, of course, plus utilities that they are charged outside of their rent. If their utilities are already baked into their rent, it doesn't count. What we see in community after community is that housing affordability is worse for renters than it is for owners. And here you see the data for Massillon. This is the percent of households in those unaffordable housing situations. It's 16.7% of renters, or excuse me, of owners, but 40% of renters. Now, the reason that we really care about housing affordability is because it can give us an indication of a lack of stability. And also, if a family or a household are paying that much just for their housing, it edges out all the other things that they need to pay for and can contribute to some of those stressors. We also know that families, especially families with children, often stretch to move into what they perceive as a better neighborhood that may be more expensive, and they're willing to take on that additional cost, but it can still add stresses and challenges for that particular family. Now, one indicator that you might sort of think, oh, that's a weird one to include there, is the share of housing units that were built before 1970. Because this is data pulled together for a health foundation, we thought this was very important because the share of housing built before 1970 can give us an indication of places where lead may be a problem, and elevated lead levels. Because the CDC banned, or the federal government banned the use of lead-based paints in residences starting in 1978. So homes built before that are likely to have some lead-based paint. It may be covered up by many other layers of paint, but if there's chipping and peeling paint, it's something that especially children can still be exposed to. Elevated blood lead level has been associated with all kinds of lifetime issues in children and is a serious concern in many communities across Ohio. You'll notice when you look at the fact sheets that there are some communities that have a very large share of houses that were built before 1970. So it ranges from less than a quarter of housing units in Canal Fulton. I mean, it makes sense. There's been a lot of newer construction in that area, all the way up to 80% or more in North Lawrence and in Navarre. Somebody will have to tell me sometime how to pronounce that.
Navarre, we got it.
Navarre, thank you. Thank you. Shifting again to think about health coverage and health access. I'll go over this data relatively quickly. Here you see the percent of people who are uninsured in Stark County by year. This is data that we had pulled for another project, but again, wanted to share with you today because it provides important context. You can see very clearly that before the full implementation of the Affordable Care Act, before Medicaid expansion here in Ohio, uninsured rates were much higher. And we see this in the state, we see it repeated. We work in policy at Community Solutions, and this is one of the only times that we see this dramatic difference in data based on what's happening in the policy world. And so once the Affordable Care Act was fully implemented, once Ohio expanded Medicaid, you can see that the rate of people who are uninsured dropped almost in half in just a few years. It sort of bounced around some, that's some sort of data anomalies, we think, but has been very steady over the last couple of years for Stark County as a whole at 6.2%. So today, more people are struggling with affordability, with access to care than they are with insurance. There are pockets of the population that still have a higher share who are uninsured. Lots of things go into that, and that's an area where if you're interested, I would encourage you to dig more into the census data for the communities that you're serving. We also have data for a bunch of preventative care measures for adults. Frankly, because of the way this data is calculated, they all tend to be in the same ranges for the communities that we are looking at. But we include the share of adults who've had a routine checkup within the last year, a dental visit within the last year. Dental's always lower than physical health. Cholesterol screening within the last 5 years, a mammogram among women ages 50 to 74, cervical cancer screenings among women ages 21 to 65, and older adult men up to date on their clinical preventive services. I'll tell you that the clinical preventive rates for women are always better than the clinical preventive rates for men. You know, we can spend some time talking about, well, why that is, but women stay much more up to date with their clinical preventive services. So we also provide the data that is available by zip code from the CDC on health status and health outcomes. And here you see a screenshot of the information that comes from the 44646 zip code. It's the one with the biggest population of all the zip codes that we looked at, and it covers Massillon, Jackson Township, and Perry Township. You can see there that 20% of adults in that zip code rated their overall health as fair or poor. That's 1 in 5. And this is sort of the overall how's your health question that we ask. We have data on physical health and mental health. And I want to point out the bold that's at the top. The share of adults who said their physical health was not good for at least 14 days in the last month and the share who said their mental health was not good for at least 14 days in the last month. When we look at other data sources, we're seeing behavioral health issues, especially mental health and mental illness, increasing for people along the age range. And the data that we're seeing coming out about youth mental health is raising some serious alarm bells. So if you follow Community Solutions, you will see us writing much more about that in the coming months. Very, very concerning coming out of the pandemic about the state of mental health, especially for young people in our communities. We also include data on risk factors and risk behaviors in both physical and behavioral health, adult obesity, adults with high blood pressure, adult binge drinking, and current smoking among adults. These are areas where Ohio does not rank well compared to many other states. Binge drinking, smoking are higher here than they are in a lot of other places. And then we have health outcomes for both coronary heart disease and diagnosed diabetes, and then depression among adults are the data that we have by zip code for the health conditions. So I've run through a ton of information, hopefully given you some context to think about as you're digging into these fact sheets. I know that the link has been dropped in the chat, and we certainly encourage you to take a look at them, to reach out if you have particular questions. But I would be remiss if I didn't tell you that there's much more that you can explore. You know, for these fact sheets, we pulled out really the high level things that are available consistently. It doesn't get in there. There's more out there that you can take a look at. You know, some great examples are housing affordability broken down by race, educational attainment broken down by different ages or by race, uninsurance, people who are uninsured by specified characteristics, looking at things by families, households that have children or may not have children. There's even data about households where grandparents are raising grandchildren and some of their statistics about their economic indicators, their housing indicators, just much more data that you can take a look at. It's really a treasure trove of information to be able to look at. And again, a reliable, timely source of information about conditions within communities. So with that, I will stop. I'll stop sharing my screen. You should all be able to unmute yourself if you have a question you'd like to ask, or please feel free to drop it in the chat.
Emily, and I wasn't planning on asking you this, but I'll go ahead and get us started for anyone else. You mentioned, and it stood out to me, I had shared with you the foundation's involvement with behavioral and mental health. And at the recent health summit last week, social media really rose to the top. And I know you said, you know, post-pandemic, but the Surgeon General came out with an advisory about social media. Is there anything that you can speak to that on a local level, or just information that's coming out? I know that's not really news to any of us, but we're hearing more and more about it in that way lately.
Yes, so that is something that we're seeing in the surveys that we do and the information that we're collecting from communities around Northeast Ohio. We're seeing the very same thing. We partnered with a large health system and did a large survey of parents and caregivers. And we're hoping to be able to get permission to publish this, but I'm going to tell you anyway. What we found is what you would expect, were that parents and caregivers' rating of children's social media use correlated directly with their rating of their overall mental health. So, you know, again, it's not surprising, but we are seeing local data that confirms some of these other national studies and other things that we are seeing. And in the pandemic, we heard you know, some children and teens really thrived. We saw some people who said that bullying decreased a lot, that they, you know, they appreciated sort of being away from the day-to-day stressors of seeing their peers, but it was very harmful for other children. And so, you know, we're seeing widening disparities on this and lots of other things. But yeah, social media. And one of the things that I'm looking at is the new data out of Ohio on the youth behavior risk survey. And I mean, crisis levels over 50% of middle school girls said that they were so sad for at least 2 weeks out of the last couple of months that they stopped doing their normal activities. I mean, that's a serious marker for depression, and statistically significant differences between genders, between races, between incomes. It's very concerning. So if you have young people in your life, I really encourage you to check in with them and try and provide whatever support you can. And meanwhile, I know this isn't about behavioral health, but information coming out about how stressed the workforce is for behavioral health, how difficult it is for people to find services that accept their insurance, how difficult it is for behavioral health agencies to retain good staff, high levels of burnout, issues with pay. So sort of happening, the supply and the demand side of things is very challenging. Yeah, we could have a whole webinar about that topic.
Thanks, Emily. I see you have some questions in the chat.
Oh, sure. Yes. Let me take a look here. Okay. Our organization has individuals with physical disabilities. Is this something that you have come across for data through Places? There isn't much data on physical disability through Places, but there is some data through the American Community Survey about people living with disabilities. So that's the source that I would point you to. It both has data for communities about the share of people living with a disability by age, by the type of disability. It's all self-reported data. And then also things like median income differences, poverty differences, some of those things for people with disabilities. So that is the best source. And thank you for that question, Sarah from Adaptive Sports, Ohio. All right, Benjamin asks, are the Health Foundation of Greater Massillon's giving priority areas changed from past areas that they supported?
So I'll take that one. Yes. No, they are not changing. They're just maybe getting a little bit more fine-tuned, more specific. You'll notice if you've applied in the past for funding, if you revisit the proposal, there are a couple of new questions. It's by no means an overhauled application, just some data questions that ask you to look at the data that we've shared today or other data sources that are all the more meaningful to your entity that you integrate into your project, your activity, that helps inform the Health Foundation of Greater Massillon. But no, there's by no means any overhaul, but just some more specific focuses.
And Amy, you bring up a really important point that I want to mention too, is that these aren't the only data sources. You all know your services, you know your communities, you know the kinds of information that's useful to you. And so, we hope that this is a resource, but there's lots of other good stuff out there. It's certainly not exclusive. And that brings us to a question from Angela about there does not seem to be much data specifically on the needs of older adults. I see Dawn has responded saying Community Solutions is working on a needs assessment for age-friendly Stark County, and we are. But I'll say that that's another area where the American Community Survey has much more data. They have a specific table in there that is conditions for the older adult population. They have it both for over age 60 and over age 65 that has most of these other data points for older adults. So we had to limit, we wanted to keep these fact sheets to 2 pages. We could do a fact sheet just on older adult data and some of this information, but that's another area where I would point you to the US Census Bureau's American Community Survey at data.census.gov to be able to take a look. And I will drop in the chat that link so that you can go right there and mess around with the data. Okay, our program is under AmeriCorps Seniors and we gather our own data through client volunteer surveys. Is there a way to share that or support what you are finding? We love looking at data. So yes, that would be great, Crystal. Thank you. Will the Center for Community Solutions be involved in Health Foundation of Greater Massillon's funding decision process? We will not. We have provided this information as a resource to the foundation and as a resource to the community, but we are not involved in any of those funding decisions. One thing I'll say is if there's a particular piece of data that you're looking for or hoping to find, feel welcome to email me or info@communitysolutions.com. We tend to know what's out there, So we'll just tell you either where you can find it or that it doesn't exist. We do provide consulting services if there's something specific, a research project. We do partner with agencies, but most of the time we can save you some time by just telling you where you can find it or that it's not out there. And this is the best you can hope to find. Because we spend lots of time. We have a whole team that spends their days looking at data on community conditions.
And I should point out on a broader level, this topic is very specific to the geographic footprint and the mission of the Health Foundation of Greater Massillon. But the United Way of Greater Stark County, Stark Community Foundation, we're partnering with the Center for Community Solutions to update our Stark County community assessment. The last one was released in 2019. The 2023 version will be updated at the end of August. So you'll receive, or end of summer, we might creep into September. So you'll see even greater data points that encompass all of Stark County that may complement some of your work as well.
Yeah, and a shameless commercial for some other work that Community Solutions has done. Earlier this year, we released fact sheets that have some similar data, but some different for every legislative district in Ohio. So for the state Senate and the state House, they're the only ones that are out there because we had to do a lot of gymnastics to get them. But if you are doing advocacy with policymakers in Columbus, they are a great resource of data for each individual district. And I dropped that in the chat as well. All right. We have thrown a ton of information at you. One question that we haven't gotten yet, which we almost always do, is will this be recorded or will the slides be available? And the answer to both of those questions is yes. As you know, we are recording this webinar. We will be making that available. It will be posted at the same site on the Stark Community Foundation website that was shared earlier. And I'll drop it in the chat one more time. And we can also email, oh, Callie already did it. And and we can email folks as well some of that information. It's also where you can download the fact sheets, take a look at them, digest them. Amy, before we close, do you want to just remind folks about what some of the next steps are here?
Sure, yeah. If you are interested in pursuing a competitive grant from the Health Foundation of Greater Massillon, I would just reiterate that their fall grant cycle, the application deadline is August 31st, and the award date is around October. Opposite of that, and then looking into 2024, they do have a spring grant cycle as well. And that application deadline would be around February, the end of February of 2024, and they meet in May. But again, all of that information is on the link that is posted in the chat.
Wonderful. Well, unless anyone wants to jump in with any last minute questions, you know, I want to thank all of you for your time today, for the opportunity to share some of this information with you and to think about and talk about the communities that you're serving. I hope that you find something useful out of what we've provided today and what you'll find there on the website. And certainly encourage you to reach out if you have questions about certain things, either to Community Solutions or to the Community Foundation. Because of course we want to see great solutions in communities.
And if I could add a quick plug as well, I always like to remind folks, and this is a great opportunity for Stark Community Foundation to share with you, and I may have shared it with some of you, the story at starkcf.org. And again, that story at starkcf.org. Any communications, mailings that your organization releases, please keep us in the loop. We like to keep in connection with organizations even outside of grant proposals, grant applications. Keep us in the loop so we can share what's going on in your organization, in your world, with our family of donors. So we do look at that information and we use it in many ways. So please include that on any of your communication materials. And that's on our website as well. If you didn't jot the email down, everything's there, hopefully. Thank you. And thanks again, everybody. Appreciate your time.
Sure, thank you. Have a great day, everyone.